Hey guys, this is Dr. Sean over at the Natural BodyWorks, or actually Fortis Colleges, or whatever college, it doesn't really matter. We're going to go over skeletal terminology right now. So I have it all up on my screen above, all over there, and all this kind of junk. So we're going to, where am I looking up there? I'm looking up there. So I get this all backwards. So anyway, whatever, you can just figure it out. This is from the book. So you don't forget to download the book, go through the book. You're going to zap through. We're going to talk about the prefixes first. That's the easy part to do. When we have a basic, let me get over the right thing there. When we have a basic prefix, we have A as in atrophy, atrophy. Atrophy means it's not growing. Trophic means to develop and to grow. So we have atrophy, or achondroplastic. So it's not achondroplastic. It has to do with dwarfism. But anyway, what it means is the plastic means growing too. Chondro means cartilage, and there's no growth of cartilage properly, so they don't grow the way that they should be, and they become dwarfism. AB, ab, as an abduction. So when we're adduction, we're adding to the center. So this little guy, remember, I don't know, hopefully you guys did anatomical position, but it's like this, right? So you got this guy, your hands are always like this, your thumbs are pointing out. This is different. Don't worry about this one. Think about this side. So we're doing abduction is this way, abduction, and then adduction is this way. Similarly, if your hands are whatever like this, adduction, abduction. I do that because it's anatomical position. This is something you guys should get used to when you're doing chart notes. You're always thinking of the patient in anatomical position. So if you say something is on the right, it's on the patient's right, no matter which way they are. So this guy here is like, if I'm standing like this is my left, this is his left. But if he stands like this is my left, this is his left. This is my left, this is his left. So it's totally different for each one of these. And that's something to get used to really, really quick, because it'll help you with a lot of direction stuff. AD towards, we did that one already. Brady means slow, like not Tom Brady, but just Brady, as in bradycardia. You would say a slow heartbeat. Bradycardia. Cardio means heart, or bradypnea, pnea, P-N-E-U-M-A, pneuma is the word for breath or life if you're in Greek. And so it's apnea. You don't breathe. You're not breathing for this one, right? Dys has to do with not being able to do whatever. Dys is painful. So dyspnea, right? We go back to pneuma, right? Is pneuma, right? Pneumonia, right? Dyspnea means difficult or painful breathing, okay? Dystrophic, difficult growth, okay? Hyper is above, like hypertrophy, more growth. Hyperglycemic, you have too much sugar. Hypercapnia, you have too much. Capnia means it has to do with carbon dioxide. You have too much carbon dioxide in your system. Inter, between, you have a lot of muscles that are inter, so you're intermembranous, and you have interosseous, which means between the bones. So a lot of the bones in here, there's muscles between them. That's called interosseous, right? And intra is within. We don't really see that too much in anatomy and physiology, but you know, we're there with intra, within. Intracranial, inside my head, right? Inside my head. Intracranial bleed, for example. Polydactyly means you have extra fingers. Like we already have many fingers, right? You have 10. And so polydactyly means you have an extra one. Say, not for your like this, like something like this. Generally, they'll just cut them off, or I don't know, maybe they leave them. I don't know. Maybe some of you guys have 6 toes or 6 fingers or whatever. Dogs get them a lot, so do cats. It's not an uncommon thing. Polymyalgia. See, polymyalgia would be like many muscles hurt. Myo, and remember we talked about myo versus sarco. Myo means muscle. Algia means pain, right? Cephalgia is a headache. Okay. Below. Subcutaneous. Yeah, we did that one last chapter, right? Subcutaneous tissue. Subdural, right, is inside the skull. Okay. Supra, above. Supraorbital usually is a real easy one. So there's muscles around the eye. There's infraorbital, there's supraorbital, and then there's lateral ones, and then there's the ones called abducens and stuff like that. Don't worry about it. Syn means together. Synthesis, like pubic symphysis or synesthesis. Trying to think of better sin words. I'll think of one, and when I come up to it, I'll get it. Let's look at the combining forms on this. If I can find them. There we go. Combining forms. Oh, look at all these here. Really good. So ankylo, we have ankylosing spondylitis, which means it stiffens the spine. Okay, it's a hereditary condition that you get when you're already born. You have to have a blood marker for it, HLA-B27, yada yada yada. But ankylosing is usually used with ankylosing spondylitis, main term. Apo Aponeurosis is a set of tissues, usually in the abdomen. You'll see them when you look at the little guy in your book, and he has all the muscles and stuff, and you'll see like a white stuff through here, or white through here, or white on top. That's called aponeurosis, and it's basically like a giant, like a big tendon. It's a big flat tendon. Okay, it's like a sheet of fibrous tissue. Okay, arthro, like arthritis. Okay, or arthralgia means pain. Arthritis means inflammation. It doesn't mean infection. It means inflammation. Okay, so you can have septic arthritis, which would be from an infection, usually bacterial septic arthritis. Septic is some kind of usually bacteria that's causing problems in there. Where are we at? Bursa. Bursa, you don't see it other than using as a bursa. So bursa is, imagine like you have bursas in your knee. You have bursae. Bursa, bursae. Bursae are many. Bursae in your knee, your hips, and your shoulder, and your elbow. And you can get bursitis. Okay? Bursitis is inflammation of the bursa. Imagine what a bursa is like a Ziploc baggie like this, right? And you put a couple drops of oil in it. And then when you have between two, like a muscle and bone, it can slide and smoothly slide no problem. If it swells up, it gets like this, it swells, and then you have friction or pain and stuff like that. Inflammation almost always causes pain. That's actually one of the hallmarks of inflammation. Let's go over them real quick. I'll tell you what they are. The 4 hallmarks of inflammation are dolor, which means pain, right? And then calor, which means heat as in calories. And then we have dolor, calor, edema, which is swelling, and rubor, which means redness. So redness, swelling, heat, and pain. Those are all the hallmarks of inflammation. Carpals has to do with the wrist. These are carpals, and then you have metacarpals in through here. Down in the feet, they're called tarsals. Okay, think of like you step on the tar, right? That's an easy way to remember. Chondro is cartilage. You have cartilages in this area, in through here in the ribs. Okay, there's like costo. Costo means edge or rib. Okay, so it means edge, like the coast. Along the coast is the edge, and so the edge of your chest. The costal cartilage, you have costochondritis, is an issue where the meeting where the bone meets the cartilage gets inflamed for some reason, usually from stretching wrong and stuff like that. Claviculo, that's this one here, collarbone, clavicle. Okay, so you can have claviculitis, I suppose you can have claviculosis. I don't know. You can have all kinds of costa ribs. We did that. Cranio has to do with the cranium. This is the skull. Okay, cranium is this whole thing. Okay, you have a bunch of different bones in here, and then there's sutures in through this section. So in the skull, there's 8. In the cranium itself, there's 14 for the face, and then you include the 14 including the jaw. So there's a lot of different bones. You have frontal bone on the front. Okay. Parietal on the sides. If you know Spanish, parietal means wall, or pared means wall, and so there you go. That's that. This occiput in the back of the head down here, and then these guys are the temples or temporalis, and then we have zygomaticus and nasal bones and maxilla, etc., etc., etc. Okay, go through those. Fibulo, what is this? Disc. Disco is intervertebral disc. It could be any disc. There's also a disc in here in the jaw called the temporal mandibular joint. So temporal, and then mandible, TMJ. So when people say, oh, I have a TMJ, they're usually talking about TMJD, which is temporal mandibular disorder, which means that you get swelling in here. Okay, that's a temporal mandibular joint. There's a disc inside there. There's a couple other discs in the other areas too, but that's the main ones. Femoral, upper leg, thigh bone, yeah, okay. Fibula on the outside. Fibula is the outside smaller bone on the leg. You can break it and still walk. It's crazy. Humero Humerus, not as in haha humerus, although it can be sometimes because you hit your humerus, which is the funny bone. There's kind of like a weird thing. It just feels funny. You're actually hitting a nerve right in through here called the ulnar nerve. You tap that sucker and you feel it through your fingers like, oh, that's funny. And that's the funny bone, okay? Olecranon is this part here. This bone through here is this here, these guys, is the humerus, okay? On the outside, the one that moves around is called the radius. It has a radius, right? And the other one on the bottom is the ulna. And we'll get to those, I'm sure. Ischio is the ischium. That has to do with ilium. That has to do with the pelvis. So pelvis, I have a whole big pelvis sitting right here somewhere. I lost it. I'm going to show you on this dude right here. So check it out. Here's an easy way to do it. So sacrum, 5 bones fused together. Coccyx, okay, not coxal, C-O-X-A-L, that's the hip bone. It's coccyx, C-O-C-C-Y-X. Over here, we have the iliac. Put this over here. Hang on there, buddy. Hang on a second. He won't cooperate. Whatever. Okay, so this is the iliac crest. This is the anterior on the front, right? Anterior, superior, here's the inferior, iliac spine. This is the ilium, this whole thing here. This is the iliac fossa. Fossa means indentation. So this through here is the pubis, and there's the pubic symphysis. It's similar tissue as to the discs in here. Down here, your sitting bones is called the ischium. I-S-C-H-I-U-M. Ischium is your sitting bones. Okay, so those are all the pelvic bones right there. Lumbo, here we go, this guy again, here we go. Lumbar spine right through here is 5, 4, 3, 2, 1. 5 in the lumbar, 12 in the thoracic, 7 in the neck. Way to remember that kind of is that, what do you got, 7 in the morning you have breakfast, noon, 12 o'clock you have lunch, and 5 o'clock you have dinner. There you go. And then 5:04, I guess, because 5 is the sacrum, right? And then 4 more bones is the coccyx. At 5:04 you have dessert. Whatever. I don't know. We'll think of something. You got to think of some stupid ways to learn these things, right? Mandible, maxilla, upper jaw, meniscus. Meniscus is, so when you're looking at a glass and you see the water in the glass and it comes up on the sides, that's the meniscus. Meniscus. The meniscus is also like a separation between two places. It's in your knee. You have a meniscus. Okay, a meniscus is kind of like the joint, and you can displace that. Myelo means spinal cord. Osteo always means bone. Patella. Patella is one of the unique bones. It's an irregular bone. Right here, it's a patella, which is a sesamoid bone. Means it looks like a sesame seed. It kind of, is it like the shape right there of the sesame seed? Close enough, right? Whatever. Pelvis, we talked about the pubis, right in the front. You get kicked in the pubis, right? Pubic symphysis is the connection of those two, and then it comes out and becomes right through here. Where we go. So the pubis comes up this, there's the pubis, the pubic bone comes up this way, it becomes the ilium at the top and the ischium at the bottom. Okay, petroliths, petrostone, pelvis, okay, phalango means pokey, okay, phalanx means pokey, okay, so you have how many phalanxes or phalanges, right? We have 5 on each hand, 1, 2, 3, 4, 5. But phalange bones, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 on each hand. That's a majority of the bones you'd have to know in the body, right? So you have a proximal, a middle, and a distal phalange. Same thing on the feet. So if you look at those, that's 14 plus 14 is 28 plus 2 feet, right? Your feet, right, has the same number. That's 56. 56 bones of the 206 already taken care of. The rest is like a bunch of ribs. There's 24 ribs. Then you have like 12 thoracic vertebra and 7 cervical, neck, right, and then 5 lumbar. So it's easy, right? Just not as bad as you think. Spondylo, so ankylosing spondylitis. Scolio means curved. That curve, there's different kinds of curved in the spine, okay? So you have this curve, when I see this guy. This curve going this way is a kyphotic curve. Normally it's a kyphosis. This is a lordosis. This is a lordosis. This should be straight. If it's curved this way, that's a scoliosis. Okay? Sternum is the breastbone. That's the chest plate right there. Tarsals, we talked about those. Ten, as in tendinitis, tendinosis, tendinopathy. Tibia is the front shin bone, and then the ulna, we talked about that one, and vertebra. There we go. Let's see suffixes real quick, get through these. Where'd it go? Ah! Okay, so we have a bunch of these AL pertaining to. So you have tendinal, pertaining to the tendons, right? But osteal, pertaining to the osteal problems or something like that. Algia, pain, cephalgia. You could technically have any of these. You could have arthralgia, right? You could have chondralgia, cartilage pain. You could have myalgia, as muscle pain. AR pertaining to patellar. That's a good one right there. So the patellar pertaining to the kneecap, right? Asthenia, myasthenia. Usually has to do with you don't have osteosthenia. This doesn't make sense. Myasthenia gravis, very bad, right? Myasthenia means muscle weakness. Centis, surgical puncture to centesis. Okay, so we have centesis. They do a lot of those with bursa centesis, I suppose you would say. Clasia, break, classis, break. Okay, class. Class means it's like catechism. The class means to break down is what it means. So you have osteoclast, which break down bone tissue, and osteoblast, which build bone tissue. That's not a really good one. You're going down to graphy, process of recording. So a radiography or a osteography would give you information on those, right? Osteogram, right? Record. Pertaining to septic, sepsis, and septic. Malacia is softening of the bones. Lysis is loosening, separating. Lysis is a good one to know because you have lytic or lysis, means to tear apart. Okay. Oid resembling oma, tumor. Osteoma is a bone tumor. Myoma is a muscle tumor. Fibroma is a fibrous tissue tumor. And adipoma, you can have those too. Physis growth, osteoplasty. That's what it really is right there. Raphe, suturing, repairing. You'll get words on there. I can't think of any right now. Sarcoma, malignant tumor of the sarco. Sarco usually means like connective tissue, so some kind of malignant tissue, connective tissue disorder. Schisis, split, scopy, to look at. Scopy would be microscopy, looking at small things, right? Tomy, tomy is to split down. Tome or atomos. Atom means not be able to split down anymore. Can't split, right? And trophy is nourishment. We talked about that one too. So there we go, guys. That's the entire chapter for those. Go through. You can learn the bones. We have the axial skeleton in the middle. The appendiculars, the other stuff. Remember the axial skeleton. It'll ask you all the time. It includes the head, the spinal cord, the rib cage, but not the pelvis. Okay. Bones of the skull, you go through those. You can learn those really quickly. That's very easy for you. It gives you the numbers, which we've already gone through. And there we go. This has been about, 18 minutes of flying through this. You can watch those. Oh, it gives abduction, adduction, rotation, circumduction. So here's circumduction versus rotation. Rotation is like this. Circumduction is making a circle. This is rotation. This is circumduction. That's the difference, okay? Adduction, abduction, those kind of things. Here's my cat. Oh, hello, buddy. How you doing? He come to say hi and give me a hug. That means we're all done here before he bites my face, which is what he'll do in a few minutes as soon as his ears go back. That's one of the things that he likes to do to me, so he's kind of feeling lovey-dovey, but not for long. Talk to you later, guys. Good. Do your homework. We'll talk to you soon. Bye.